Welcome everyone to episode 38 of Tiny Healthcare. Today we're talking about microexpression number 2, part 2. So what are microexpression tests? That's my puppy in the background playing. Microexpression tests are short assessments that measure how well you can recognize very fast, involuntary facial expressions. The ones that fly for, 1 of 25 to 1 to 5th of a second before people can hide them, like I repeated in my last episode. These tests are often used in psychological research, emotional recognition training, law enforcement or security screening programs, clinical and therapeutic communication training, as well as AI and computer vision validation. The types of microexpression tests that I will go through are microexpression training tool. That's the first one. It's probably the most famous test created by Paul Ekman, which shows faces expressing universal emotions for 200 milliseconds to 1 second. You choose the correct emotion: anger, fear, sadness, disgust, contempt, surprise, happiness, blah, blah, blah. And it gives you accuracy score and the reaction time. This method is used to improve emotional recognition skills. Second, subtle expression training tools, also called SET, focuses on very small or partial expressions, not rapid ones, good for detecting hidden emotions. And these are expressions that appear only in the eyes, mouth, or brows. And I believe, using the law enforcement, like the test where it is admissible as evidence, and all that, it really would work. Third is a Japanese Caucasian brief effect recognition test. It's used in academic research. It's a neutral face is shown. A micro-expression flashes for 17 to 67 milliseconds. The neutral face returns, and you'll identify the emotion. It measures pure perceptual recognition ability. Fourth is AI microexpression benchmark test. It's used to create CASME2, which is a Chinese system that's developed by China for facial expressions, microexpressions, SAMM, and SMIC. These data sets show real microexpression recorded at high speed, which is 100 to 200 5 FPS, I guess that's like less than milliseconds. Sorry. Okay, lastly, clinical communication microexpression tests. Some therapy or medical communication programs use short video clips of patients expressing brief emotions. Trainees must label emotions intensity and authenticity, useful for psychiatry, counseling, and nursing. So, what are these tests measure? Well, they measure the accuracy, the speed of the response time, the consistency, the stable across trials, as well as cognitive load in some tests. So, again, there are limitations in ethics, obviously, such as microexpressions are not proof of lying. Well, you know what? It is. Recognition accuracy varies widely across individuals. Just keep watching live TV, you'll know. Some people take Diazepam, which is Valium, or I guess the equivalent, to pass the lie detector test, because it slows your heart down and it doesn't detect on the lie detector test. So, in terms of microexpression, that might be a little different than just a regular lie detector test that measures your vitals or whatever it is. And lastly, AI microexpression detection tools raise the privacy, consent, as well as misuse concerns. And we all know that. Thank you, and see you next episode.